pain, neck pain, to have issues with their feet. So I'm going to open up her feet and then her hips again. I'm going to open her feet by kind of grabbing her ankle and twisting and pulling. There. And you'll feel pops and you might hear clicks. Right? Come to the other side. Same thing. Now, let's open up her hips. I'm going to flex her feet, okay, to relax her tendons and her ligaments. Grabbing her ankle and her foot, I'm going to pull along the straight line and release. Same thing. And release. Now I'll have her turn over. We're going to work on her shoulders. You always want her to turn her head away from you. So I'll ask her, turn your head. You're going to place her in what appears to be a hammer lock. Going to slide up underneath and place your palm on her shoulder, okay, on her scapula. The other hand comes up underneath and just supports her shoulder. And all you're doing is just opening up the shoulder. Very nice. Move her head back down. Find her scapula. And then press gently. Now, remember, in Tuina, no work is done directly on the spine. So what I'm going to do is feel the spine with my fingers and then place my palm right off the spine between the spine and the scapula. And I'm going to press gently but firmly in a continuous motion. And this will release ribs that are out of place. It doesn't take much pressure, and the first time you do it, you'll be amazed. You'll feel that pop. There. Now, with her head still facing away from me, I'm going to cross the table and release her hip. Always tell your patient what you're about to do. I'm going to grab your hip, okay? Okay. So I'm just sliding my hand up underneath. I'm feeling her pelvis and just putting my hand under her pelvis. Some patients tend to tense up at this moment, so you just tell them simply relax and let their body fall. You take your other hand and place it not on their spine, but at the lower half of their ribs. Her ribs end right about here. So I'm placing my hands right above that, and I'm going to pull in a twisting and then a second motion, more of a pulling manner. 1, twist, and 2, pull. Alright, now at this point I'm going to release her hips again, but I'm going to use a wonderful technique. This is a technique that releases the piriformis muscle. And this muscle, because of its location, because of the nature of how it interacts with the pelvic girdle, many patients' complaints can be resolved with this technique alone. It's pretty amazing, pretty profound. The first thing I'm going to do is I'm going to check her leg length. So I'm going to do this by bringing her feet together and simply bending her knees. Okay, now, In some patients, in fact many patients, the majority of patients, when you do this, now I want to bring her knees straight up.